Hi, my name is Caroline, and today I'm going to explain to you what glaucoma is. So basically, this is when there's a buildup of pressure in our eye because there is a blockage in our eye drainage. The reason this is dangerous is because when that pressure builds, it starts to push up on our optic nerve. That's our second cranial nerve, and this nerve is responsible for our vision. A specific glaucoma is primary open-angle glaucoma, and a symptom of this would be peripheral vision loss. So you start to notice that you can't see out of the side of your eye anymore. A second glaucoma would be our angle closure glaucoma, and this is different because with this you're going to notice pain. You might notice your eyes are red, and then you're going to also see some blurred vision involved in this glaucoma. A third glaucoma is similar to the first one mentioned, and it's called normal tension glaucoma, and again you're going to notice that peripheral vision loss. Some basic care you can do is keep up with your ophthalmologist, regular eye exams to make sure everything's functioning well. You can avoid heavy lifting or anything that will really put a lot of pressure on any of those nerves, kind of keep that blood pressure, maintain it under control to help avoid any excessive pressure in our face or in our eyes or anything of that nature. And exercise is important, so, you can always do walking, or you could even do Pilates, something that's a little bit calmer on our heart rate. So what are some safety measures that can be taken for a patient experiencing glaucoma? Well, if they're having vision loss, then they can, make sure their home is well lit. They can have night lights put in place, so that way, it's never a completely dark room. We don't want any kind of falls to happen. You can install handlebars in bathrooms and showers, so that way they can, have that extra help and balance. The biggest thing is that we want our patients to be safe, and we don't want any kind of falls to occur. Avoiding any kind of nighttime driving is always a really safe option. So overall, glaucoma is essentially vision loss, and there are things we can do to avoid it, by keeping up with our doctors and such. And then if we do end up experiencing this, or somebody then there are some safety measures that can be put in place, to kind of help avoid any other issues, such as a fall, like I mentioned several times before. Anyway, I hope that was helpful, and I hope you found this interesting, and yeah, have a great day. Bye.